Hello, my name is Heather Tillewein. I am an assistant professor at Austin Peay State University, and I'm here presenting on adult male and female inmate population, looking at the social vulnerability index and influential risk factors. So a little bit of background of the study. In 2019, the state and federal imprisonment rate was 149 per 100,000 U.S. residents. This made up about 1,430,800 prisoners in the United States. In 2019, our prison system was made up of 92% male, with 19,500 newly admitted inmates that year. Also, out of those who were incarcerated, there was a little bit over 1,000 Black prisoners per 100,000 Black residents, and 525 Hispanic prisoners per 100,000 Hispanic residents, and 214 white prisoners per 100,000 white residents. Our imprisonment rate for Black females was 83 per 100,000, and for white female inmates, it was 48 per 100,000. And then for our Black female prisoners, it was 1.7 times the rate of our white female inmates. So there is some adverse health impacts due to being an inmate. They're often fed really high fat, high calorie foods. They live in poor ventilation areas, overcrowded detention centers. They have restriction due to movement, lack of human contact, which has a negative impact on their mental health. There's poor sanitation in these prisons, infestations of insects, lack of family visits, noise, lack of privacy, the tension that's always created, and then cross-gender pat searches. And cross-gender pat searches can be very traumatizing, especially when you talk about female inmates and those who have obviously previously been sexually assaulted. There's also increased risk of HIV transmission in prison systems due to sharing needles, drug use, or tattooing that you'll find within these systems. So the impact that our prison system has on our inmates, so whenever they get released from prison, they have issues finding housing, work, reestablishing these social relationships that they once had. Increases the odds of former prisoners to be homeless or marginally housed. And then there's a lot of inmates that lack access to healthcare, other resources for treatment or receiving medications. And while they were in prison, they were most likely getting their medications. And then when they get released, their medications may halt. We also find them unemployed, low socioeconomic status, living in unstable housing, and our low access to healthcare is also associated with poor mental health. Especially when our inmate population. Most states also don't allow inmates to receive any social services such as food stamps, housing, or student loans. So they are left to be in the low socioeconomic status, trying to find employment, trying to have reduced food insecurity. And then we saw there was a correlation between our adult male population, several factors that can influence our prevalence of inmate population, such as socioeconomic status, housing type, disability, housing composition, vehicle access, minority status, and language. For my methods for the study, I took the Census of Jail 2019 survey data and also the Social Vulnerability Index, which is created by the CDC. The Census of Jail 2019 data set came from the National Archive of Criminal Justice Data. They do a nationwide survey on inmates in local jails and the annual survey of jails, and they combine it to give you the number of adult male and adult female inmates in our jail systems. So that was the most recent data set that they had per county. And then I took the Social Vulnerability Index 2018 data set because that was the most recent at the time. Like I said, it was developed from the CDC, and they use 15 census variables to determine how vulnerable your county is. So it goes on a scale from 0 to 1. 1 meaning you are the highest vulnerable in case of a catastrophic event or a natural disaster. 0 meaning you are not that socially vulnerable. And within that index, they also measure overall social vulnerability, and they also use 4 themes to determine what type of vulnerability your county has. And so they use socioeconomic status, minority status and language, household composition, disability, and housing type and transportation. And I use these themes to show the influences of different factors. So for the SVI, here's a bit of how each theme was broken down. So socioeconomic status, you have poverty, unemployed, housing cost burden, no high school diploma, no health insurance. For our household characteristics, you have age 65 and older, age 17 and younger, civilian with disability, single parent households, English proficiency. For racial and ethnic minority, they just looked if you're a minority and if you speak English well or less than well. This is the updated SVI, so a couple of these factors weren't included in the 2018 data set. For our housing type, we have mobile unit structures, mobile homes, crowding, no vehicle, and group quarters. So for my analysis, I looked at overall SVI based on inmate population. That gave me a counties, over 2,465 counties that I looked at. So for the adult male inmate population and looking at the overall SVI ranking, it was significant with a p-value less than 0.001. Same with our adult female population. So overall SVI ranking was also significant. I did a NOVA to determine the significance from all four themes in each inmate population. So for the adult male and adult female, it showed for overall SVI and overall SVI in the inmate population for both of them, male and female, it was statistically significant. So for my results of my study, this is for my adult male inmates. For my adult male inmates, based on those four themes, the ones that were significant was our household composition, disability, minority status, language, and housing type and transportation. So all these four themes showed up significant. As you can see, household composition, disability is the one that's negatively correlated, while the rest are positively correlated. And then socioeconomic status was not significant among the adult male population. So I broke down the factors that were significant, or the themes that were significant, into each individual factor, and I ran them against our population to see if it was significant or not. So the ones that were significant was our age 65 and older, age 17 and younger, minority status, multi-unit structure, mobile homes, crowding, group quarters, and no vehicle. There was a positive correlation with the factors of minority, living in a multi-unit structure, crowding, and no vehicle. And then there was a negative correlation amongst adult male inmates that are over the age of 65, being younger than 75, and living in mobile homes or group quarters. For my adult female, all four themes were significant. Socioeconomic status and household composition disability were negatively correlated, but minority status and language and housing type and transportation were positively correlated in the study. For my adult females, I looked at every factor. So the positive correlations I had was below poverty, unemployed, no high school diploma, multi-unit structures, mobile homes, group quarters, no vehicles. The negative correlation was age 65 and older, age 17 or younger, and single parent households and income. And just remember that females were the only one with the socioeconomic status as significant. What was not significant out of all the factors that made up these themes was single parent household, crowding, civilian with disability, minority, and then speaks English less than well. So what we can tell from that is if you're a male inmate population, all four themes or three themes were significant amongst that population, such as household composition, disability, minority status, and language, and housing type and transportation. So when our population goes up, we assume that a lot of those factors would also increase as well. Female population was positive for all of the four themes. Socioeconomic status, like I said, was not significant among the adult male, but weirdly enough, it was negatively correlated with female population. So what they were taking was how low of an income you were. So with a female inmate population, it's very interesting that kind of had, when that decreased, our female prison population increased. So we could see the factors that could possibly influence our inmate population and address those risk factors. Being a minority was only significant in our male prison population, was not significant in the female population, which kind of contradicts the research that Black men and Black females have higher rates of being imprisoned. The SVI data suggested that it was not significant in female inmates. We can also say that male and female inmate populations have overlap when it comes to several factors that influence them. And with these, we can reduce barriers and promote resources to these counties that have such a high social vulnerability. And if we address these factors, it could possibly reduce the prevalence of our inmate population, and we can cater interventions to these specific factors based on if you're targeting males or females and what factors influences them, especially when we talk about education, housing, and transportation. And that is the end of my presentation.